Why prevention matters. A wake-up call from Hyderabad. Namaste and welcome to the very first episode of Future Proof with Dr. Chaitanya. I am your host, Dr. Chaitanya, a preventive care specialist based in our very own Hyderabad. This podcast is for everyone, whether you're a busy techie in Gachibowli, a homemaker in Amirpet, a student juggling classes and screen time in Himayatnagar. Together, we are going to break down the big picture of preventive health, how it works, why it matters, and how it can literally change your life. So let's begin with a simple question. Why prevention? Why should you spend time, money, and your energy on something that doesn't seem like a problem yet? Here's the truth. By the time you have a symptom, it's often too late. Not too late to act, but too late to avoid damages. Most of the health conditions I treat are diseases that have been silently growing in the background for the last many years. And I mean silently. In 2024, a Hyderabad-based study conducted in partnership with a series of diagnostic centers and a very large hospital in Hyderabad found that nearly 65% of all the people who came for preventive health checkups had signs of serious chronic health disorders. These included fatty liver, borderline diabetes, high blood pressure, and even signs of kidney damage. And here's the kicker. Over 50% of them had no symptoms. Let me tell you about my friend Ravi, 43-year-old IT professional from Gachibowli in Hyderabad. Works at a tech firm, goes to the gym, does not smoke, does not drink. But he had one habit, long hours at the desk ordering food almost daily. He came for a checkup just because his company was offering a corporate health checkup. His blood sugar 180 fasting, liver enzymes high, blood pressure 150 over 100. He was shocked. He looked shocked. And here's what he said, "But doctor, I feel fine." That's the danger of chronic diseases. You feel fine until one day you don't. Think of your body like your car. You wouldn't wait for the engine to stop working before getting it serviced. But with your own body, we somehow expect everything to run forever without any maintenance required. That's not how biology works. Prevention isn't about living in fear. It's about living in control. It's about being proactive rather than reactive. Now, you may ask, okay doctor, I get it. But what exactly should I be doing? Well, we'll get into that in future episodes. Everything from the top screening tests you need to diet changes that actually work. How stress impacts your body, how sleep heals your body, why exercise is medicine, and even how your habits can influence your children's health years from now. But in this first episode, I want to drive home just one point. Health is not the absence of disease. Health is the presence of vitality, presence of energy, presence of clarity, presence of strength. And that doesn't come by accident. It comes by design. Hyderabad is a city full of achievers. But what's the point of all the achievements if your body breaks down by your 40? I want to challenge you. Don't just live longer, live stronger. Here are 3 actions you can take today. Book a preventive health checkup. Not only if you're above 40, even if you're between 20 and 30, a health checkup is a must. Track one daily health habit, like water intake, your sleep hours, or the number of steps you walk. Talk to your family. Encourage your parents, your brother, or your sister to check their health also. You might be saving a life. In our next episode, we'll break down the exact health tests you should be doing at different ages and why they matter. If anything in today's episode made you pause and think, act on it. Don't wait. Consult with me personally, online, or in my clinic. Book your preventive health session. The link is in the description. And if you found value in this, please share it with someone you care for. Prevention is powerful and it starts with awareness. Until next time, this is Dr. Chaitanya. Stay future proof.